Alabama added more than 950 new coronavirus cases today. That is a large increase over case counts from recent days and the second highest single day uptick since the start of the pandemic. Dr. Karen Landers with the Alabama Department of Public Health joins us now. Thank you so much for being with us tonight.
Thank you, Naja.
The new cases pushed the state's 7-day rolling average up to almost 673, an 80-case increase over Tuesday's average. How concerning is this?
Well, it's extremely concerning that we continue to have these very high numbers of cases of COVID-19 in Alabama. And there are a number of factors that are contributing to this. One specifically is widespread community transmission of COVID-19, but we also know that we have a number of cases that are in clusters or outbreaks, as well as cases that are epidemiologically linked, which means that they have been around persons in their household or very close contacts and subsequently contracted COVID-19.
Alabama is also recording more deaths as a result of the coronavirus. 25 more deaths were reported Tuesday, bringing the state total to 879 people. What is your perspective on this?
Well, again, every death is tragic. Every death is a loss to the community, a loss to a family, a lost loved one. So we are deeply, deeply sorry that these persons have passed away. And what we do know is that while our death rate is certainly much higher in older persons or infirmed persons, that persons that are otherwise healthy can possibly be in this age group. Now, as far as underlying health conditions, again, we have had a small number, but a significant number of persons pass away in the I believe it was about 32 persons that have passed away that have not had underlying health problems.
The Alabama Department of Public Health has been in charge of keeping up with these numbers. What are some of the challenges you faced?
Well, the challenges in keeping up with the data is there is a massive amount of information coming in. Just for example, our laboratory testing through our Bureau of Clinical Laboratories, as well as our laboratory testing from commercial laboratories and clinical laboratories that report to us, represents a very, very huge amount of information coming in. I mean, we have well over 350,000 lab reports coming in, and again, every week we're probably testing about 25,000 test numbers per week. So that's really, really significant to our overall data coming in. And then with our cases have to be entered in as soon as the laboratory report is received and assigned to an investigator for follow-up and contact tracing. So again, a lot of data to display on our dashboard, a lot of statistical calculations, and a lot of comparison data.
What else can be done to slow the spread of the virus?
We really have a limited spectrum of recommendations for COVID-19. Again, this is a respiratory droplet. It's spread person to person. So we know that the way to reduce respiratory droplets is to keep people separated and to wash our hands and keep our hands clean and to wear cloth face coverings and keep our surfaces clean, which really still contributes less than the person-to-person respiratory droplets. And again, the fewer people that are together, the less likely there is for transmission to occur. So we really have a very, very limited medical prescription. As I've said many times before, this is medical advice. This is a medical prescription that we have right now until we have the availability of a vaccine. Again, we have the drug remdesivir, but this is a drug that has to be used in critically ill patients, and certainly we don't want people to get to that point.
Anything else that would be important for us to know tonight?
I think the most important message is that we can combat this virus, but it's going to take everyone, individually as well as in families, as well as in the community, to combat this. Again, we all have to work together. This is a critical time. It is an unprecedented response, But we can do this. We can slow the spread of this virus, and we can keep the pressure off of our healthcare system. But it does require our adjusting to some activities that are really not our normal. It's our new normal. And this is what we have to do in order to reduce the spread of this virus.
Dr. Karen Landers with the Alabama Department of Public Health, thank you so much for your time tonight.
Absolutely. Thank you, Naja.